let's move on to menstrual cycle basics. And this is going to integrate those hormones that we talked about so far. But instead of just talking about what's happening at the level of the ovary, we're really going to get into also the ovarian and uterine interaction and what's happening at the level of the endometrium, that really important inner layer of the uterus that is built up and shed every menstrual cycle. Again, to go over and just review what this menstrual cycle looks like, this is what's going on at the level of the ovary, this top part. The hormones are depicted here in different colors, and then what's going on at the level of the uterus, specifically the endometrium, is this bottom part. So normal menstrual cycles are about 28 days, plus or minus 7 days. Amenorrhea is a term when somebody doesn't get regular cycles. Usually it's because they don't ovulate, but there are other reasons for that as well. Oligomenorrhea is when somebody has menstrual cycles from day 1 to day 1 that are greater than 35 days. If somebody has menstrual cycles that are greater than 35 days, but let's say they're 36 days or 37 days, and they occur at a regular basis, we probably wouldn't call that person oligomenorrheic. This is more a term that's used for patients who get cycles 3 or 4 times a year. They're unable to tell when they ovulate. They don't get the feeling of PMS sort of symptoms, and when they get their period, it's usually pretty heavy because they've only gotten it a couple times a year. Polymenorrhea is a term that's used when the day 1 to day 1 of the menstrual cycle is less than 21 days. And we see this as people start to go into menopause. The beginning part of the menstrual cycle shortens and becomes smaller. So instead of 14 days, it gets shorter and shorter. And what occurs is then the cycle day 1 to cycle day 1 get closer and closer together. We need to talk about the phases of the menstrual cycle because you're going to hear about these a lot. And the importance of the phases really has to do with what's dominating the phase at that time. So if we're talking about it in terms of the ovarian phases, the first thing that we're talking about is the follicular phase. So again, we're talking about the ovary here. The follicular phase is the first 14 days of a 28-day menstrual cycle. It's called the follicular phase because it mostly is concerned with the growth of a follicle. The second phase of the ovarian cycle is called luteal phase. And the reason it's called the luteal phase is because it is mostly dominated by a corpus luteum or corpus luteum formation. That is the second 14 days of a 28-day cycle. If we shift and talk about the phases of the menstrual cycle when we're talking about the uterus, the first 14 days is called proliferative. And the reason is proliferate is another word for growth, so that's the easy way to remember it. And the first 14 days is under the influence of estrogen. Estrogen here is this yellow line. You can see that it's rapidly increasing. And as the estrogen level increases, the uterine lining increases, grows, or proliferates. So that's called the proliferative phase. And then the second part of the menstrual cycle, when we're talking about the uterine, is the secretory phase. This is a menstrual cycle lining that is under the influence of progesterone. Remember that progesterone is what creates that Velcro-like texture of the uterine lining that allows an embryo to implant. So the second part of the menstrual cycle is called secretory. You can see that there's starting to be some glands here. These are producing secretions and nutrients for an ongoing pregnancy. Even though the second part of the menstrual cycle in this picture and other pictures looks like the lining is thicker than the beginning, it's not a true thickness in terms of growth. It's actually a swelling because of all these glands and nutrients. And when we talk about what this looks like with the ultrasound, you'll see the difference in terms of the pattern of the uterine lining. And you can kind of figure out where somebody is in their menstrual cycle by the pattern of their uterine lining. So the follicular phase, remember that's the first 14 days of the ovarian cycle, is variable. It takes a different amount of time for people to make follicles and for those follicles to mature. Remember, if people go into menopause, their follicular phase might be shortened because the follicles are usually of poorer quality. Some people who have long menstrual cycles take a long time for those follicles to grow and mature. Conversely, though, the second part of the uterine cycle, the luteal phase, is only 14 days for almost everybody, unless they have something called a luteal phase defect. So the corpus luteum has a finite lifespan of 14 days, unless it's what we call rescued by HCG. The corpus luteum's whole job is to create a nice, cushy place for the blastocyst to implant and to make hormone levels such as estrogen and progesterone until the placenta takes over. Well, the placenta doesn't take over until a couple weeks after somebody's already been pregnant. So the corpus luteum is what supports a pregnancy until then. The corpus luteum knows then if it needs to stay on and support a pregnancy if the HCG hormone is being produced. HCG is the hormone that's produced when somebody's pregnant. And if HCG is not produced, the corpus luteum will realize, I'm not necessary anymore. So it starts to then grow and it starts to die off. And then as a result, these estrogen and progesterone levels will decrease. Estrogen and progesterone levels start to drop 7 days prior to a period. And menses, or the period, starts about 3 days after progesterone is less than 1. Progesterone is measured in nanograms per milliliter. So if somebody comes and sees you and they say, I haven't gotten my period I'm 10 days late for my period, and we do blood work and an ultrasound on them, and we get the blood work back, and you see a low estrogen level, and you see a progesterone level less than 1, then you can tell your patient you're probably going to get your period in less than 3 days. Obviously, we would always be checking a pregnancy level on anybody that came to see us who had amenorrhea or the absence of a menstrual cycle. Just to go back to these uterine phases, we want to see what they look like by ultrasound, because this is what you're going to be seeing when you go in the room with the patients. And usually we call these linings certain names depending on where the patient falls in their menstrual cycle. So just a reminder, the first 14 days of the uterine cycle is called proliferative, and that because it's the growth of the uterine lining. And the second part is the secretory, and that's what makes the uterine lining conducive to the implantation of an embryo. If we look at an ultrasound picture of somebody who's in the proliferative phase, what you would see then, and just to orient you to this picture, here is the outline of the uterus. The ultrasound probe would be up here. The cervix would be here. The uterine lining then is this white in here. Uterine lining walls are usually collapsed on each other when there's nothing inside, such as fluid or a pregnancy. But if you see the uterine lining, you'll see that it has 1, 2, 3 lines. We call this triple line or trilaminar lining. And this lining is usually indicative of somebody in the proliferative phase of their menstrual cycle. When we do a measurement of the lining, we measure from this little star to this little star. And the thickness of this tells us how good of a job the uterine lining did in developing that month. Most centers like this uterine thickness to be 7 millimeters or more. It could be a little bit thicker, and your own center may have its own protocol for this. But if the uterine lining doesn't develop and thicken, we start to wonder if there's something that's going on with that person's uterus in terms of scar tissue that might require more of an evaluation of their uterus, either by a hysterosalpingogram or saline sonogram. Let's contrast this picture to what would look like in the second part of the uterine cycle, called the secretory phase. Again, here's the outline of the uterus in this picture. Here's the uterine lining, this white. But what you can see is there's no distinct middle line there. We can't call this trilaminar. In fact, this uterine lining all looks the same. It doesn't matter if I look at it in the middle or the top or the bottom. Because it all looks the same, we call this homogeneous. This is a homogeneous uterine lining. This is indicative of either somebody that's in the process of having their menstrual cycle because of all the menstrual shedding in the blood in the cavity, or somebody in the second part of their uterine cycle called the secretory phase. Remember, in the previous picture, this was represented by those glands, those nutrients, those secretions. So if you do an ultrasound in the second part of the menstrual cycle, what you would see is somebody's uterine lining look like this. Again, this is called homogeneous, and this is called trilaminar. The first one is trilaminar or triple line.